On January 12, 2026, New York City witnessed a historic moment in healthcare labor history. Nearly 15,000 nurses, represented by the New York State Nurses Association, walked off the job, marking the largest nurse strike in New York City history. This strike did not happen overnight. According to the union, nurses were forced into this action after months of negotiations failed to produce any meaningful results. The strike spans 5 major hospital systems across New York City. These include Mount Sinai Hospital and its Morningside and West campuses, Montefiore Medical Center, and New York Presbyterian hospitals. Nurses from these institutions began their strike simultaneously, impacting thousands of patients and drawing nationwide attention to the conditions inside America's hospitals. According to the union, the reasons behind the strike are clear. First, unsafe staffing levels. Nurses say hospitals refuse to agree to enforceable nurse-to-patient ratios, leading to dangerously high workloads that make it harder to provide safe, attentive care. Second, health benefits under threat. The union states that hospital management proposed cuts or reductions to nurses' healthcare benefits nurses rely on while caring for others. Third, workplace violence protections. Despite repeated incidents of violence inside hospitals, nurses say leadership failed to implement adequate safety measures. The union emphasizes that these demands are not about convenience or luxury. They are about patient safety, not just working conditions. Hospital officials have pushed back against the union's claims. They argue that some of the demands, including wage increases, are financially unsustainable. Hospitals say they have contingency plans in place, including hiring temporary replacement nurses, and insist that emergency and essential services remain operational during the strike. In response to the strike, New York Governor Kathy Hochul declared a state of emergency, citing concerns over staffing shortages during an active flu season. New York City Mayor Zohran Mamdani publicly expressed support for the nurses while urging both sides to continue negotiations. Other state and local officials, including the Attorney General, have also voiced support for safe staffing standards and stronger protections for patients. At its core, this strike highlights long-standing tensions between frontline healthcare workers and some of the wealthiest hospital systems in the country. Nurses argue that safe staffing, fair benefits, and workplace safety are non-negotiable when patient lives are at stake. Hospital administrators warn of financial strain. As negotiations continue, the outcome of this strike could shape the future of healthcare labor standards, not just in New York City, but across the United States. This is